What's up everybody, it's Dr. Michael Mash with Barbell Rehab, and today we're going to talk about what to do if you have knee pain during squats and 3 simple tips to fix it. But before we get started, make sure to like this video and subscribe to this channel if you find it interesting. That helps us get this message in front of as many people as possible, and we appreciate it. So today again, we're talking about knee pain during squats. And the first question I have is, why do people get knee pain during squats? One of the biggest reasons that somebody may get knee pain during squats is called a load management error. Basically, you may have done something too fast with too much load before your body had the chance to really adapt to it. And we see this with too much squatting in general. So take somebody that maybe is very untrained, hasn't really worked out, and then all of a sudden they decide that they want to try and squat 3 times a week for high volume. This can directly lead to knee pain because you did not give your knees enough time to adapt to the stimulus. Or maybe you're well adapted to a posterior chain dominant squat variation like a low bar squat, and then you try and dose in a knee dominant variation like a front squat at too high of an intensity, volume, or frequency. Regardless, many times knee pain during squat can be caused by a load management error or doing too much, too fast, too soon. So how do we fix it, right? Well, the first thing I would do is you need to swap the variation that you're doing that's causing knee pain out for a variation that limits stress on the knee. So that would be a low bar squat. A low bar squat is very, very knee friendly because it is a posterior chain dominant variation where you sit back, the torso inclines forward, and very little forward knee migration occurs. So if you're having pain with an overhead squat, a front squat, or a high bar squat, I'd recommend switching to a low bar squat temporarily to get the knees to calm down. You can't just keep pushing through something if it hurts. You need to change something, and in this case, we're swapping out the variation to make it more tolerable. Once the knee pain calms down, you can then slowly progress back to the knee forward variation that you choose. So if you are somebody that wants to do front squats, maybe you run low bar squats for 4 to 6 weeks, and then retry doing front squats with a very light load to see if your knees can tolerate it. Or maybe you're somebody that has knee pain with overhead squats, and we regress it to the high bar squat and then slowly build back up again to the overhead squat. So step 1, calm it down, try swapping in a low bar squat. If the low bar squat itself still hurts the knees, then you may need to take a break from squatting altogether. If that's the case, then you can just up the volume on some of your posterior chain work, like maybe you'll do more deadlifts or RDLs for 4 to 6 weeks while the knee calms down. The other thing that you can try if you have knee pain during squats is adjusting your foot and stance position. Generally speaking, a wider stance with more toe out is going to limit the amount of stress on the knees, because that wider stance with toe out is going to force more hip abduction or hip abduction, which is going to load up the hip adductors or the adductors. So if you're somebody that's feeling pain in your knees with your squat, sometimes getting those feet out, turning them out, can really shift the load from the knees to the hip adductors and really change the pain experience. So step 1, try a low bar squat. Step 2, widen the stance, turn the toes out. Step 3 is you can try doing tempo squats or slowing down the movement. Oftentimes when you introduce tempo work, and in our case, the general recommendation is 3-0-3, so a 3-second descent followed by a 3-second ascent. This works twofold. One, we know that if it's a tendinopathy or a tendonitis issue, whether it's the quad tendon or the patellar tendon, tendons like tempo. Tendons respond really, really well to slow tempos because the slow tempo is what forces the tendon adaptation down at the molecular level. So tempo work. And the second part about doing tempo work is you usually don't need as much intensity or load on the bar to stimulate a training effect. So if you're dealing with knee pain during squats, you may be able to get a good, tolerable training effect with a lighter load and slowing the tempo down. So that's what I got for you on knee pain during squats. Again, low bar squat to calm it down, step 1. Step 2, then change your stance width, degree of toe out, widen the stance, turn the toes out more to shift stress off of the knees, and then step 3, slow the movement down and decrease the load. Again, if you like this video, make sure to like it, subscribe to our channel. We appreciate you for watching this, and I'll see you on the next video.